of what we're trying to achieve with the treatment, and in general what the treatment will involve, and what side effects we'll be watching out for. They don't really want to know much more than that.
Okay.
And it's kind of strange as well for, say, new nurses, if they come to the area as well, they might be real gung-ho about
they're ready
what
to
they want
give
to.
all the,
like, oh, I know all this knowledge and I want to give it all over here. But like, I find that, and I probably did that one time too. I'm not, because I remember with new myeloma patients way back in 13 years ago, I'd often give them an hour plus of my time.
Yeah.
And what's wrong about that is they then think you have that amount of time each time you see them, when you don't. So it's not just the fact that most people don't need, because they're not going to remember much of it either. If you give like loads and loads of info and they're still dealing with the shock and comprehending what this is and what it involves,
not even hearing you,
then they're not hearing much of it. They're retaining, they reckon, less than 20% of what you're saying is heard and stored as such in the brain. So for two reasons I don't give big long introduction times of what the condition is and what it involves, both for that but then some patients do need more time, and if they do need more time I'll give them more time, but I tend to try and keep it to half an hour tops at the first time, especially if it's a diagnosis that's come as a shock. It's different from those that we've been kind of hinting towards it, and we're waiting on tests and they're getting snippets of information as they go. But for something that's come out of the blue, and you know, sometimes even in acute leukemia they got a tooth pulled and the bleeding wouldn't stop, and then a blood test gets done, and you know, like, it's strange scenarios.
Okay, so there's a couple of questions now that you've kind of touched on already, but I'll ask you again anyway.
Yes, okay.
So the first one, seeing patients when they're in, you know, a very vulnerable position, what impact would you say that has on you when you're seeing or dealing with a patient? I
suppose you do your best not to become emotional yourself, and that can be hard if it's but there's been many times where I might become a little bit teary and I can't keep it under control, but I suppose as long as it doesn't get to the point that, like, if it happens maybe like it did while I was talking to you before. It doesn't normally get to the point that I can't communicate, or do you know, and as long as I think I've always got it clear in my mind, and my empathy is coming from picturing it being my brother, my father, my mother, my sister, or do you know, and that's where the empathy is rooted.
Right.
But to remind myself that it isn't my family, and that I have a very different role to play here compared to the role that I would take on if it was my brother, my father, my brother, my sister. Do you know, and so I think as well, the times where I maybe did find it more challenging earlier in my career taught me a lot, in that if I was going to stay longer term in the area, and obviously I took break by going to Australia for the year, when I came home to Scotland I worked mainly in district nursing for a year, so that was another break from the intensity of, but I still came back to it, but taking those breaks then helps you take a bit of a different tack as well, maybe. And then what I've often said to people that decide that they think they want to be in this area of nursing for the long term is that we play an even more important role in looking after the patients that we cannot cure and cannot make their disease go away than what we do for those that achieve getting on with the rest of their life. And I think if you can be a constant and not shy away from those difficult situations, then that's part of what's important about the role. Do you know? And if I didn't think I could do that, I probably wouldn't have stayed in it long term. I couldn't cope with the kind of I couldn't cope with only being there for the good outcomes and shying away and avoiding the difficult times.
To disconnect from
because if you're going to be good at your job